Alex, thank you so much for joining me to talk about the latest research on physical activity.
Of course, it's been too long. And as we've seen over the last few months, the health benefits of exercise are now more important than ever. And as social distancing restrictions begin to ease...
Whoa. You mean I can leave my house and see people again?
Yes, but there are still safety measures to observe. Caitlin?
As you can tell, I'm very excited to see people in person again, but many of your members might need to be reminded that social distancing is still crucial. So as you communicate all of your increased cleaning and the measures you're taking to keep gym goers and your staff safe, be sure to remind them of all the ways they can help.
Like staying at least 2 meters away from each other, bringing their own water and towels, wiping down equipment before and after use, and of course, regular frequent hand washing.
So now that I'm here with Alex in her backyard and we are appropriately distanced, we wanted to share with you 3 studies about how exercise can help your mind, your body, and your immune health. This pandemic has everyone thinking about how to improve their immune system. And for a long time, people thought exercise would have a negative impact, partly because some research showed that marathon runners reported an increase in upper respiratory tract infections following a race. Those are things like the flu or a cold. However, new research says this might not be true.
An extensive review examined how physical activity and exercise can benefit immune health. The authors looked at 4 things: the data on short and long-term effects of exercise on the immune system, clinical benefits related to the link between exercise and immune health, the influence of nutrition on the immune response to exercise, and the effects of exercise on immune system aging. For now, I'll talk about the first 2. The authors found that acute bouts of exercise enhance the circulation of immune cells like T cells and natural killer cells that help the body fight disease and help reduce inflammation. When the authors reviewed randomized controlled trials, they found that people assigned to long-term moderate intensity exercise programs had fewer cases of upper respiratory tract infections, in some cases by as much as 40 to 50% among people active on a daily basis. A similar analysis from long-term population-based studies found a 28% drop in upper respiratory tract infections with higher levels of physical activity and fitness.
So if these studies found that exercise could reduce your chance of getting the cold or the flu, what about those marathon studies?
In a lot of those studies, they didn't really confirm the existence of an upper respiratory tract infection. So someone who reported a sore throat or a dry cough could have experienced that from the running itself. In addition, someone could have developed an upper respiratory tract infection from traveling, being in close contact with a bunch of people, or other factors not related to the running itself.
So exercise is good for immune health, but what about mental health? A lot has happened in the last few months, and people are so stressed and anxious. Amid the coronavirus pandemic, a third of Americans surveyed in early May reported anxiety, depression, or both.
Research suggests that regular exercise could help create greater emotional resilience to acute, short-term stress in otherwise healthy people. The study exposed 111 adults to a stress test and a non-stressful control test. Then they asked them to report their regular exercise habits. Researchers measured participants' psychophysiological responses to the stress test, including heart rate, blood pressure, and reported mood. The research showed that while exercise didn't have a discernible impact on mood prior to the stress test, people who did not exercise experienced a greater decline in positive affect as a response to stress. Positive affect refers to the tendency to experience positive emotions and view challenges positively. The study does have limitations, but it provides some modest support for the assertion that exercise can help protect against some negative emotions related to stress.
This also aligns with previous evidence that exercise may help treat anxiety.
One study looked at physical activity and sitting time at various points during adolescence and depression at age 18. During the study, researchers objectively measured physical activity using wearable fitness devices at age 12, 14, and 16. To assess depression, a clinical interview was conducted at age 18.
After analysis, they found that physical activity declined between ages 12 and 16, and that sedentary time replaced light activity.
Every additional hour of light activity reported at age 12, 14, and 16 years was linked to lower depression scores. Alternatively, every additional hour sitting was linked to higher depression scores. In general, depression symptoms were lower in people with persistently higher levels of light activity. There was a link between lower depression scores and higher levels of total physical activity at ages 12 and 14. There was also a link between each additional 15 minutes of moderate vigorous physical activity and lower depression scores. These are just a few studies you can share to remind your members of the health benefits of exercise. And if you subscribe to my newsletter, the Health Benefits of Exercise Report, you'll get 3 studies like this every 2 weeks to your email inbox, including shareable social media graphics. In fact, all of the studies we've talked about today have appeared in the Health Benefits of Exercise Report newsletter in the past few months.
And if you want a comprehensive list of all of the resources IHRSA has developed to help health clubs navigate this coronavirus pandemic, be sure to visit IHRSA.org/coronavirus.